Well, thank you very much. It's an honor to be here, and we are very excited to be able to present the Carlton Fillauer Award. A little bit of history about Carlton Fillauer, who is my grandfather. He was born in 1920 in Chattanooga, Tennessee, to a German immigrant. His father started a pharmacy that would become Fillauer, and that pharmacy was started in 1914. So we're very excited to be able to present this award in the same year that we celebrate our 100-year anniversary. As you may know, my granddad developed a lot of products. He enlisted in the Army in 1941, and it was there that he really developed his passion for orthotics and prosthetics. When he returned from the Army in 1945, he went back to work at Fillauer, and throughout the last half of the 20th century, he really focused not just on patient care, although he was a clinician. He also focused on product development and developing techniques to go along with those products. Some of his developments included the removable medial brim, the Fillauer RGO system, the 3S custom silicone liner, and the original shuttle lock pen system. We as a family are very excited to be able to be involved in this award, and again, it's an honor to be able to celebrate his achievements and also to celebrate the achievements of those who follow in his and his generation's footsteps in developing and innovating new products for those that we serve. Thank you.
Thank you, Michael. I think Carlton would be most pleased in who we're about to honor with this inaugural award. It is my great privilege to announce that Mr. Phil Stevens, MED CPO Fellow, is to be the recipient of OPERF's 2014 Carlton Fillauer Prize. Just a few words about Phil. Prolific. That would be the one word I would use to describe the professional dedication and work ethic of Phil Stevens. A graduate from the University of Washington Orthotics and Prosthetics program in 2001, Phil began his career with Newington O&P Systems in Hartford, Connecticut. He then spent time with Hanger O&P in Bend, Oregon, Dynamic Orthotics and Prosthetics in Houston, Texas, and most recently, since 2006, with Specialized P&O Technology, a Hanger clinic in Salt Lake City, Utah. Phil is one of those rare individuals that can not only serve as a most effective practitioner of both disciplines of prosthetics and orthotics, he also has proven to be a highly productive researcher and author. Whether publishing case studies in developing patient populations, such as quantifying the importance of balanced confidence for the selection of prosthetic knees in unilateral and bilateral users, or serving as a major contributor to organized investigational conferences, such as the Academy State of the Science Conference on Microprocessor Knee Mechanisms, or the ISPO Consensus Conference on the Orthotic Management of Cerebral Palsy in Oxford, England. If one were to try to identify a central theme in Phil's written work, it would be clinical relevance. Considering Phil's self-motivation to pursue a Master's of Allied Health Education and Administration from the University of Houston while working long hours at a busy O&P practice, this really comes as no surprise. With 15 publications, his work is well represented in formal, peer-reviewed academic literature and a most impressive accomplishment for really any clinician. However, what really sets Phil apart is his dedication to what I would consider knowledge transfer. That is, he recognized the need to translate the more academic literature into mediums that the average clinical practitioner could more easily obtain, understand, and then incorporate into clinical practice. To that end, he has been remarkably productive in writing manuscripts for the O&P Edge, the Academy Today, and Advanced for Directors in Rehabilitation, all in an effort to translate research findings into the practices of everyday clinicians. When considering these additional publications, Phil has actually produced a staggering 53 publications to date, a remarkable and most meaningful contribution to the O&P profession. We mustn't also overlook that he clearly has the respect and support of his peers, earning the Academy's Clinical Creativity Award in 2011, and now serving as the Academy's president-elect after being initially elected to the Board of Directors in 2009. In recognition of these and many other sustained contributions to prosthetic science and practice, and on behalf of the OPERF Board of Directors, it is my distinct honor to present Mr. Phil Stevens, MED CPO Fellow, with this inaugural 2014 Carlton Fillauer Prize.
Well, it is truly an honor to receive this award tonight. When I consider the names that I associate with these OPERF awards, names like Carlton Fillauer, Marty Carlson, Gary Horton, Don Kotz, and Tom Gavin, they represent a legacy of dedication both to our profession and to our patients, and I'm honored to be included in that type of company. I was asked to keep my comments brief, and I will attempt to do so. It's always dangerous to mention individual names for fear that you'll leave somebody out. And I have been so fortunate in my career to have been surrounded by impressive professionals from the very beginning, and I continue to associate with such wonderful people. However, there were several that were especially influential in determining the path that my career would take maybe a little earlier on. And to that effect, I'd like to thank Marty Carlson, Tom DeBello, Don Kotz, and if you can hear me all the way in England, Chris Morris, for their patient mentoring early in my career. And then these articles never seem to write themselves, and they're never written on company time. And so, as so many of you can relate to, they're largely the product of late nights and early mornings. And so, while I'm pretty sure they can't hear me back in Salt Lake City, I need to acknowledge the support of my 3 boys back home and my always supportive wife, Jenny. In Michelle's address, she encouraged us all to find our passions, and I am very fortunate to have found mine. And to that end, I'm honored to be recognized for that passion tonight. Thank you very much.